Postural Restoration Trained, or PRT Credentialing, is a credentialing program offered through the Postural Restoration Institute for athletic trainers, athletic therapists, strength and conditioning coaches, certified special population specialists, or CSPS, and exercise physiologists. This is offered annually through our institute. And if you're interested in applying for PRT credentialing, I'm hopeful that this video will help walk you through this application process. The first part to determining whether you're eligible to apply for PRT is to look at the credentials that we accept for this program. And these credentials are outlined on page 1 of the PRT application. And the reason for selecting these credentials that we do accept is that they all require a college or a bachelor's degree, and they all have CEU requirements, as well as they regulate the scope of practice for these different professions. And since we won't be doing that for a PRT credential practitioner, we want to make sure that they are members of other organizations that are overseeing that. So that's the purpose behind the credentials that we do accept. If you have any questions about whether you're qualified to apply for PRT, please feel free to reach out to me and I can help you out with that. But the first part of your application is just some demographic information and the PRI courses which you have completed to this point. The required PRI courses for PRT credentialing are myokinematic restoration, postural restoration, pelvis restoration, and impingement and instability. Once you've completed those 4 courses, you can apply for PRT. If there is an I&I course right before PRT testing, which is often the case, you can attend that I&I course the weekend before PRT testing. And if you're planning to do that, just indicate that on your application. The first part of the clinical or academic experience is attaching thorough evidence of how you incorporate PRI principles and techniques in the athletic training room, weight room, or practice or setting that you are currently in. And in this section, we recognize that maybe not all of you actually have real case studies that you could submit, depending on what type of practice you have or what types of patients or athletes or clients you're seeing based on your profession. But if you do have case studies, or even case studies you can put together, they may not be as formal as a clinical case study put together as a physical therapist, but showing your use and progression of PRI concepts with athletes or clients that you're working with on a continual basis is really helpful. Fitness programs that you have put together, rehab programs if you're working on the rehab side of setting, any demonstration or use of PRI concepts, especially the objective tests and application to the PRI non-manual techniques and manual techniques, if you are allowed to perform those in your practice, is really helpful in this section. Discussion and just thorough examples is what we're looking for in this section. Feel free to also include any research that you have done, articles that you've written, blogs, case studies, in-service materials you put together for staff or colleagues, as well as any other educational materials that you've developed based on PRI concepts. All of that is helpful in this section. Again, the main concept in this section is just providing thorough evidence so that we can see a good grasp. Just providing pictures only of athletes or yourself doing PRI techniques doesn't show us your understanding of the PRI concepts and the science itself. So we need to see application to a program or a case study or a rehab setting that you're integrating this in to your practice. And if you have questions, please feel free to reach out to me. The next section is listing out your 3 favorite PRI non-manual techniques and explaining why. This is a section where we're looking for 1 to 2 pages of a description of a PRI non-manual technique. I would recommend selecting 3 different techniques. So for example, don't select 3 that are all supine 90-90 positions, but select 3 different positions or 1 from each course, showing your understanding of what it's doing, why you selected it, and kind of the importance behind that technique. There's a list of questions here to make sure that you answer throughout the 1 to 2 page discussion. And those questions are: what is the purpose of the technique? In your experience, what is the likely outcome of the technique? What techniques would you use before, after, or even during or in conjunction with this technique and your program? What cues do you find helpful when instructing the patient, athlete, or client through this technique? Do you make modifications to the technique? If so, what are they and why? And what types of diagnosis or objective tests would indicate that this technique is appropriate for your patient, your client, or your athlete? Part 3 of the PRT application is the critical research review. In this section, we ask you to submit 2 articles which are supportive or related to PRI concepts. Again, we would like to see some variety here, so selecting 2 articles on the same topic would not be advised. Please select 2 different articles that show your understanding of PRI concepts kind of across a wide range. We listed some suggested journals. You are not limited to those journals. Those are just some ideas. Or you can just get online and start Googling topics such as diaphragm, telefemoral pain, shoulder impingement, respiration, asymmetry, just some keywords that pop up commonly in PRI that you could possibly find an article to review. After that, we would like your 2 ideas or suggestions for clinical research in the future. What would you like to see research done on and why? And some examples. How might that research be carried out? What would you expect to see from that research? We have people all the time asking for research ideas, so getting input from PRT applicants is always helpful in this area. And then the last part is the PRI advocacy. And this is where we want you to tell your story. We want to get to know you. We want to know your background, where you came from, who mentored you, how you were introduced to PRI. What type of practice are you practicing in now? What do you see for your future? How do you want to be involved with PRI? Have you hosted courses? Do you want to host courses? Are you teaching? Are you doing research? Just lots of examples of what you could include in this section. But really, this is a way to kind of share your story and what you've done with PRI in the past and what you hope to do with PRI in the future. And as I wrap up this video, we do have some examples of the non-manual techniques on here and the critical research review. So at the end of the application, you can take a look at that, which will give you some more helpful information. But as I wrap up this video, just a few key reminders. Thoroughness throughout your application is expected, and that's what the review committee will use to determine whether you are prepared to attempt and complete PRT testing. Demonstrating use of the PRI objective tests throughout your practice, whatever that might be. It might be screening athletes preseason and postseason. It might be individual screenings versus group screenings. It may be in the athletic training room, actually using objective testing with assessments of your injured athletes. Those are just a few examples, but how are you using these objective tests and how are the objective tests guiding your intervention, whatever that might be? We want to see variety throughout your application because we need to make sure that each applicant has a thorough understanding of the 3 primary courses: myokinematic restoration, pelvis restoration, and postural restoration. If you've attended the I&I course, we would also love to see your understanding of that course as well, inclusion of reference centers, for example. If you haven't attended that course, we knew that based on your application, and you've already indicated you plan to attend that before testing. And then lastly, anything you can do throughout your application to maybe reflect on your time in working and integrating PRI concepts into your practice is helpful. So maybe there's something that you did back then that you wouldn't do now. Reflecting on that and sharing why you might do something differently based on maybe more PRI courses you've attended. And also feel free to include information throughout your application from other courses that you've taken outside of those prerequisite courses, such as affiliate courses, PRI vision courses, secondary courses that you've taken, symposiums you've attended. Any other information you can tie together just helps the review committee understand how much more you're integrating that you may not have otherwise included if you were just basing it on that 3 prerequisite courses. If you have any questions whatsoever about the PRT credentialing program, please feel free to reach out to me. That's why I'm here. I'm here for support for you and to answer any questions you might have. So feel free to shoot me an email or give me a call or just reach out to me, whatever's easiest for you. Thanks and have a great day.